Um, how did you decide physical therapy was what you wanted to study?
I decided, like when I started my job at a pain clinic in the summer of like last year, and we were working with like a lot of patients, and my doctor would always be prescribing like physical therapy scripts and stuff, and like I would just like bond with those patients, and I could see like myself doing something more hands-on with them and helping them and building a relationship with them, and that's what I like if it wasn't for my job, I probably wouldn't have considered physical therapy.
When did you decide that you wanted to study it?
I decided my winter semester of freshman year, so winter 2011, that's when I decided. And I started taking classes and majoring in health science and having my pre-concentration in physical therapy.
Did you like the classes?
Yeah, I really did. I was interested in a lot of them, and like it was, I'm very good with sciences and stuff, and I knew like business wasn't my way and stuff, so I just really enjoyed learning the science.
What is your favorite thing about it? About learning about working with people and exercise and stuff?
Honestly, I just like to build a relationship with people, especially like the patients and stuff, just because like I know that you're gonna be seeing them more than once a week, and like you learn about them, and you know what I mean, they always have someone to come to and talk to, and you just build that relationship, and I really like that, and I like learning about them and like putting like a positive attitude towards them, because I know like with physical therapy you're coming in with like a lot of pain and you're stressed out, and like I feel like it's the physical therapist's job is to change their mood and to make them better.
Have you started studying for the exam to apply to the program?
I have not yet started studying for it. I am actually going to start studying for it next summer, was when I'm planning on taking it. And yep, that's it.
Okay. And then do you know like what schools you want to apply to yet, or not yet?
Well, I'm thinking of just applying everywhere in Michigan. I think there's like 5 schools in Michigan that you can apply to, and I'll apply a few outside of state, but I'd like to get into schools inside of Michigan if I can.
Do you know any physical therapists?
I know a few, especially the ones that come into my job that I work at that talk to my doctor. So I actually talk to them a lot about physical therapy, and I also have like a few family friends who own some physical therapy clinics that I've also shadowed at and stuff that that actually made me even more interested in wanting to become a physical therapist.
What makes you interested in it, and why?
Basically, honestly, just helping out the people and just learning about them and keeping them thinking positive and that they can get through whatever they're going through. And I love doing that, and I love helping people and making them feel better.
Are you dedicated, determined to pursue this, or?
Oh, definitely.
Okay. Do you know like the environment you want to work in? I know there's like a lot of areas that.
Well, I still want to shadow at some I haven't shadowed at a hospital yet. I kind of want to see that environment. But so far, I've just really liked like the outpatient clinics, and it's not as like straight out of surgery type of thing. So it's a little more, you're not dealing with too much crazy stuff. So I really am interested in that.
Do you volunteer at anywhere at that?
I haven't volunteered yet. I'm thinking about this summer just volunteering at like many different places, like doing pediatrics and work with like just all random types of fields in physical therapy.
Obviously you shadowed. Did you enjoy it? Or did you learn a lot?
I loved it. When I went to shadow at our family friend's place, honestly, like I was like on my own, and I started doing ultrasounds. I also I right away built a relationship with one of the patients, and like I loved it a lot.
What do you think? When you think what you want to do for the rest of your life as a career, is physical therapy what you see, or are you kind of leaning towards something else?
No, I see myself as a physical therapist. I don't know, I just feel like every time I picture it, it's just I can see myself.
Okay. So you kind of like know. What do you want to specialize in? Do you know yet, or are you still kind of just exploring?
I'm actually really interested in the sports medicine field with the physical therapy, just because like I'm a huge sports fanatic, and like I've like chat out at a sports medicine place, and I really enjoyed it, and like especially like sitting down talking with a patient who's like into sports and I'm into sports, and like you just it's just fun. I think sports medicine is just a lot of fun.
Are you scared of not getting accepted or being rejected, or and if so, do you know a second career choice, or would you still try to pursue it?
I wouldn't say that I'm scared. I might be a little nervous, but like I'm pretty confident. I just know that I have to really just like do very well in my science classes, really kill it. And I mean, if I don't end up getting into where I want to go in the first, like I'll do whatever I need to do to make sure I can get in. If I have to retake classes, I will, just because if I had a second choice, but I just really want to.
Okay. And then, do you think there are certain qualifications or characteristics that make you, I don't know, make you want to feel like you are a physical therapist, or anything in the medical field? Are there certain things that you think that someone needs to have?
I think for sure, just because you really have to be a people's person. I've seen many physical therapists who just stand around and just tell their patient, just do 10 sets of this and do 3 reps and that, and it's just I don't like that. I feel like you should build a relationship with your patient, and you should be able to have when you do see them, and just have fun with them and make them feel good about themselves, because obviously they're in a lot of pain, and you just you have to be a very outgoing people person. You have to be hyper. And when I was in physical therapy myself, because I had gotten injured, and when I was talking to my physical therapist, he had mentioned, he goes, the huge thing is you really have to be a people's person. You can't just be in that corner,
Yeah.
And he told me, he's like, I can see you, you have that personality, you have that. And I was like, I really like it.
Okay, well, thank you.